I am passionate about the fact that I have two patients when I have a pregnant woman. I have the mother and I have the baby, and I care very much that both of them end that pregnancy in a healthy manner. I'm not just taking care of one or the other. I decided to become an OB/GYN because there were so many things about gynecology and obstetrics that I loved when I was in my training program. The writing was kind of on the wall when I showed up on my spring break to deliver more babies, just because I felt like I hadn't delivered a baby in 3 months and wanted to be there. I loved being part of a woman's life at some of the most beautiful and some of the most difficult times of her life. I loved the mixture of surgery and clinic, labor and delivery. I loved both having short-term relationships and long-term relationships. It was just a package that I got really excited about and still do. My favorite part of being in the clinic setting is the patients. Everyone is so diverse. People have different interests, they have different approaches, they care about different things, they ask different questions. I love that diversity in the clinic because it means that every patient is an adventure. When a patient comes into either the Sunflower Clinic or to the Family Birthing Center over at the hospital, they can expect compassionate and caring staff who truly care about both mother and baby. The hospital recently achieved premier status for the High Five program, which assesses the benefit of both mother and baby at the time of delivery. And there's a number of standards that they have to hit in order to achieve that, but I think it speaks well for the way that the hospital has emphasized delivery care. The focus of my practice at Sunflower OB/GYN is really a mixture of general obstetrics and general gynecology. I'm not specialized in one particular area. We do a mixture of high-risk pregnancy, low-risk pregnancy, abnormal bleeding, fibroid uteri. My interests and hobbies include reading. I do love to read. I'm a quilter and a cross-stitcher. I suppose it's kind of par for the course that a surgeon loves having a needle in her hand. I enjoy exercise. I love travel. I really enjoy different languages. I speak reasonable Spanish. I also have experience in other countries, so I speak Hindi or Urdu. And I really enjoy the diversity of those patients. So I welcome those that just would like to talk to somebody who understands what it's like to be a stranger in a strange land. Even if I don't speak your language, I enjoy the diversity. I would love for the community to know that I'm grateful for the ways that they've welcomed me. The first thing that attracted me to the Winfield community was the colleagues. I really loved the people that I interviewed with. I loved the staff. I loved what they said about each other. I loved the way they talked about each other behind their backs. I call it gossiping good. But it was just so consistent. People loved each other here. I was unfamiliar with Winfield when I moved down here, and so that was one of the highlights. And as I moved out into the community, I realized that that's actually fairly widespread. Even outside of the hospital, people consistently talk well about the hospital and about each other and about the providers that they've seen.